life is tough. This is something that we have all been told at some point in our lives. And if you're anything like myself, then this was a lesson that you had to learn early on in life. The reality of being a human being is that there are always going to be things that we're experiencing that are outside of our control. And sometimes even the things that we can control are still things that we wish that we could change, even though we may not exactly be able to. And therefore, we all experience some form of distress at some point in our life. We all have many daily stressors, and sometimes it feels as if these stressors are too much to cope with. And if we aren't able to cope, then we start to have mental and physical changes that are a result of this constant stress. And this is one reason that so many people all around the globe attend therapy, to help cope with life's daily stressors or their own mental issues that they're experiencing. Hello, my name is Mary Wright, and today we're going to be discussing therapy, more specifically cognitive behavioral therapy. Unfortunately, over time, people who have attended therapy have kind of been given a negative label, and this is mostly due to the fact that there's a general misunderstanding about what therapy is and how it can help individuals from all different walks of life. The most commonly utilized therapy in our contemporary society is psychotherapy, or talk therapy, as many people call it. This therapy is the most common therapy, and it involves a therapist sitting one-on-one or in a group, depending on the client's needs. And at this time, the therapist should remain objective and use research and evidence-based therapy techniques in order to help these clients form more effective life skills, healthier thought processes, and more healthy behaviors in general throughout their life. Cognitive behavioral therapy, or CBT, as I'm going to be referring to it from this point on, is one of the most prominently utilized therapies in our modern therapeutic society. CBT is a structured, time-limited, and directive approach to therapy in which a lot of homework is given to the client. And this is to encourage the patient to work on their life skills and changing their thought processes outside of therapy as well as inside of the therapy sessions, because the therapist cannot always be around to guide the behaviors of the client. The goal of CBT is to help clients change their dysfunctional thoughts and behaviors to more healthy and more rational thoughts and behaviors. CBT is a combination of both behavioral and cognitive therapies, as its research has proven that a person's cognitive processes, such as thought, are directly correlated with that person's external behaviors. Lao Tzu, an ancient Chinese philosopher, once said, "If you correct your mind, then the rest of your life will fall into place." This is exactly what CBT maintains, that when we think negatively and irrationally, that we cause ourselves to have negative behaviors, which then results in negative consequences. Okay, so let me paint a picture for you. You just learned that in a week you have a large exam that's going to come up. Lately in class, you've been having a little bit of trouble understanding the materials, and therefore, when you learn of the exam, your first thought is, "I will never pass this test. The information is too hard to comprehend, and therefore, why even try?" So you barely study because you think that it's not going to make a difference. When you take the exam, you are completely lost, and you're reading through the questions and none of them are making sense to you. The next week when you get your exam back, you failed the test, and you think, "I knew that I wouldn't be able to pass this test." Okay, so let me stop here with this situation. A cognitive behavioral therapist would sit down with you and analyze your thought processes before the exam and would identify that your all or nothing dysfunctional thinking was the main cause for you failing the exam, because you let these negative thoughts get into your head and therefore you didn't study. So that made the questions on the exam a little hard to comprehend, and of course that resulted in the failing grade on the test. Dysfunctional thoughts can be anything from all or nothing thinking, in which we don't leave any room or any middle ground for any improvement or any exceptions to the thinking or the situation. But dysfunctional thinking can also be anything such as catastrophizing an event, which means that you're mentally building up the negative consequences of the event before the event even comes, therefore closer to the time of the event, you already think the event's going to be insufferable. But in the end, regardless of which type of dysfunctional thinking will lead to negative external behaviors. Thus, why the main focus of CBT is to encourage patients to change these dysfunctional thought patterns in order to teach them to think more healthy and to be mindful of these negative thoughts so that they can then change these thoughts to more healthier thought patterns, and honestly to change their behaviors to more beneficial and healthy behaviors. CBT is used by therapists all around the globe to treat a wide array of psychological and even some physical issues. It is one of the only therapies to have been proven time and time again by research to be effective in actually changing people's thoughts, therefore resulting in people's behaviors changing. It was used by profound psychologist Beck in the early 1960s to treat patients with chronic depression. And Beck studied these patients, and he concluded that the patients who were experiencing depression almost always had dysfunctional thoughts that led to their depressive behaviors. Therefore, being able to change these thoughts that was causing them to act in this way allowed them to change the depressive actions or behaviors. It's also been widely used to treat post-traumatic stress disorder because it helps the patients to overcome their fears and their unhealthy thought patterns so that they can then begin to heal and move on from the traumatic events that they've experienced. Amazingly, through my research, I actually found a recent study that was done by Shou and his colleagues, in which they took 53 people who had either been diagnosed with major depressive disorder or post-traumatic stress disorder. And these people were then, they were first ran through an MRI before receiving cognitive behavioral therapy. And after receiving the treatment, were then again, their brains were scanned. And this was done to analyze the effects of cognitive behavioral therapy on connectivity networks within the brain. So after the patient successfully completed CBT, it was actually seen that there were significant changes in between the connectivity between the frontal parietal networks of the brain and the amygdala parts of the brain, which are both largely represented in cognitive processes. This gives a little bit of a medical idea of how when patients are learning in cognitive behavioral therapy to change their thoughts, they're also able to then change the external behaviors. CBT is also used to treat things such as anxiety disorder, obsessive compulsive disorder, and even eating disorders, along with many other psychological issues. One thing that I found to be quite interesting is that CBT has also been cited to be helpful in treating chronic pain in patients, and this was actually through studies done by the American Psychological Association. I personally have gone through cognitive behavioral therapy, and this was in order to treat PTSD, which I had due to experiencing a little bit of a traumatic childhood. And before entering my CBT, it was hard, honestly. I constantly blamed myself for traumatic things that had happened to me, and I played the blame game. Once I entered CBT, I became mindful that these negative thoughts were actually resulting in a lot of negative behaviors, and it was basically just a large cycle of negative thought, negative behavior. And it took me a long time in CBT before I thoroughly understood that once I was able to change these thoughts, I was able to change my life for the better. Thus, the reason that CBT has been so effective for so long now, and that it's still so highly utilized in the therapeutic society. Because, as I said, if you can change your thoughts, you can change your life. I do want to thank you so much for listening, and again, my name is Wright.